A patient walks into the clinic. He had arm weakness, slurred speech, and facial drooping for 20 minutes, and then it all disappeared. He feels completely fine. His CT scan is normal, his MRI is normal, everything is normal. So the nursing student watching him says he is fine, he can go home. But the experienced nurse in the room goes into emergency mode. Who is right? And more importantly, why? The answer to that question is the difference between passing and failing your NCLEX stroke questions, and I am going to show you exactly why in today's video. Let's begin. Question 1. A nursing student asks her clinical instructor to explain what a stroke is in the context of medical surgical nursing care. The instructor responds by describing the condition. Which of the following statements by the instructor best defines a stroke? A. A stroke is a gradual reduction in blood flow to the heart muscle, resulting in myocardial cell death and permanent cardiac damage. B. A stroke is a sudden interruption of blood supply to the brain, resulting in neurological deficits that may be temporary or permanent. C. A stroke is a transient episode of decreased oxygen to the lungs, causing brief confusion and loss of consciousness. D. A stroke is a chronic progressive condition caused by narrowing of cerebral arteries over many years, leading to slow cognitive decline. The correct answer is B. A stroke is a sudden interruption of blood supply to the brain, resulting in neurological deficits that may be temporary or permanent. Rationale. A stroke, also known as a cerebrovascular accident, or CVA, is defined as a sudden interruption of blood supply to the brain that causes neurological deficits. Depending on the type, severity, and area affected, deficits may be temporary or permanent. Question 2. A 66-year-old male is admitted to the med-surg unit with a confirmed stroke. His wife asks the nurse, "The doctor keeps calling it a CVA. What does that mean? Is it different from a stroke?" Which response by the nurse is most accurate? A. CVA stands for cerebrovascular accident and is simply another medical term used to describe what is commonly called a stroke. B. CVA is a more severe form of stroke that only occurs in patients with high blood pressure and diabetes. C. CVA refers specifically to a bleeding stroke, whereas the term stroke refers to a clot-related blockage in the brain. D. CVA is an older term that refers to mini strokes, or TIAs, which are less serious than a full stroke. The correct answer is A. CVA stands for cerebrovascular accident and is simply another medical term used to describe what is commonly called a stroke. Rationale. CVA, or cerebrovascular accident, is simply the medical terminology for stroke. Both terms refer to the same condition, which is a sudden disruption of blood flow to the brain, causing neurological deficits. Question 3. A 71-year-old woman is brought to the hospital after her son noticed she suddenly could not move her left arm, and her speech became slurred while watching television. She was diagnosed with a stroke. The son asks the nurse, "How is a stroke different from other brain problems, like a tumor or dementia?" Which explanation by the nurse is most appropriate? A. A stroke is different because it only affects elderly patients, while tumors and dementia can affect anyone at any age. B. Unlike tumors or dementia, a stroke always causes permanent damage that cannot be treated or reversed with any intervention. C. A stroke is characterized by a sudden onset of neurological deficits caused by disrupted blood flow to the brain, whereas tumors and dementia typically develop gradually over time. D. A stroke is caused by a virus attacking brain tissue, which is what makes it different from other neurological conditions like tumors or dementia. The correct answer is C. A stroke is characterized by a sudden onset of neurological deficits caused by disrupted blood flow to the brain, whereas tumors and dementia typically develop gradually over time. Rationale.
The hallmark of stroke is its sudden onset of neurological deficits resulting from disrupted cerebral blood flow. This distinguishes it from brain tumors, which grow progressively, and dementia, which causes slow cognitive decline over months to years. Stroke deficits may partially or fully resolve, depending on treatment and severity.
Question 4. A nurse is providing a health education session at a community center about stroke awareness. An attendee asks, "What exactly happens to the brain during a stroke?" Which response by the nurse best explains what occurs? A. During a stroke, the brain becomes overactive and fires too many electrical signals at once, which causes the brain cells to burn out and stop working. B. During a stroke, brain cells in the affected area begin to die within minutes because they are deprived of oxygen and glucose they need to survive. C. During a stroke, excess fluid builds up gradually around the brain, causing pressure that slowly shuts down normal brain function over several days. D. During a stroke, a bacterial infection enters the bloodstream and travels to the brain, where it destroys brain tissue over a period of weeks. The correct answer is B. During a stroke, brain cells in the affected area begin to die within minutes because they are deprived of oxygen and glucose they need to survive. Rationale. When blood flow to the brain is interrupted during a stroke, brain cells are deprived of oxygen and glucose. Without these essential nutrients, neurons begin to die within minutes, making stroke a true medical emergency. Question 5. A 58-year-old woman with hypertension is admitted following her first stroke. During the nursing assessment, she asks, "My neighbor had a stroke and recovered completely. My cousin had one and never walked again. Why are strokes so different for different people?" Which response by the nurse is most accurate? A. The outcome of a stroke depends entirely on the patient's age and whether they have other medical conditions like diabetes or heart disease. B. Strokes always cause the same amount of damage. The difference in recovery is due to how hard each person works during rehabilitation. C. The severity of a stroke and its effects depend on which area of the brain is affected, how large the area of damage is, and how quickly treatment was received. D. Recovery from stroke is mostly determined by genetics. Some people are simply born with brains that recover better than others. The correct answer is C. The severity of a stroke and its effects depend on which area of the brain is affected, how large the area of damage is, and how quickly treatment was received. Rationale: the neurological deficits and recovery outcomes following stroke vary significantly based on the location and size of the affected brain area, the type of stroke, and the timeliness of treatment. No two strokes are identical, which is why outcomes differ greatly among patients, even when the diagnosis is the same. And this is where it gets interesting. If outcomes depend so heavily on which area of the brain is affected, you need to ask yourself, which stroke type carries the highest immediate risk of making things dramatically worse before the care team has even had a chance to act? That answer is coming up, and it is going to completely change how you think about prioritizing stroke patients. Question 6. A 61-year-old man calls his doctor after experiencing sudden numbness on his left side, difficulty speaking, and blurred vision that lasted approximately 20 minutes and completely resolved on its own before he arrived at the clinic. A CT scan and MRI show no evidence of infarction or bleeding. The physician explains the diagnosis to the patient. The nurse reinforces which classification: A. Ischemic stroke caused by permanent occlusion of a cerebral artery resulting in irreversible neurological deficits. B. Transient ischemic attack caused by a brief, temporary disruption of cerebral blood flow with no permanent brain damage. C. Lacunar stroke caused by occlusion of a small penetrating artery deep within the brain, resulting in a small area of infarction. D. Hemorrhagic stroke caused by a small amount of bleeding into the brain tissue that resolved spontaneously without treatment. The correct answer is B.
transient ischemic attack caused by a brief temporary disruption of cerebral blood flow with no permanent brain damage. Rationale: a TIA is characterized by sudden temporary neurological deficits caused by brief disruption of cerebral blood flow that resolve completely within 24 hours, typically within minutes, with no evidence of infarction on imaging. TIA is a serious warning sign of impending stroke and requires urgent evaluation and intervention.
Question 7.
A nurse is caring for 4 patients on the med-surg stroke unit. During morning rounds, the nurse reviews each patient's diagnosis. Which patient does the nurse correctly identify as having the highest immediate risk of a full stroke if left untreated? A 70-year-old man with a lacunar stroke affecting a small, deep artery who has stable, mild left hand weakness present for 3 days. B, a 65-year-old woman with an embolic stroke caused by atrial fibrillation who is currently receiving anticoagulation therapy. C, a 58-year-old man who experienced a transient ischemic attack 6 hours ago with fully resolved symptoms and no treatment initiated. D, a 72-year-old woman with an intracerebral hemorrhage who is currently being managed with strict blood pressure control. The correct answer is C, a 58-year-old man who experienced a transient ischemic attack 6 hours ago with fully resolved symptoms and no treatment initiated. Rationale: a transient ischemic attack is a medical emergency because the risk of a full ischemic stroke is highest in the hours immediately following a TIA, with approximately 10 to 15% risk within 90 days, and the greatest risk occurring in the first 48 hours. A patient with a TIA 6 hours ago who has received no treatment is at the highest immediate risk. Early intervention with antiplatelet therapy, imaging, and risk factor management is critical.
Question 8. A nursing student is studying the classification of stroke and asks her preceptor to explain the difference between a thrombotic and embolic ischemic stroke. Which explanation by the preceptor is most accurate? A, a thrombotic stroke occurs when a clot travels from the heart or another vessel to block a cerebral artery, while an embolic stroke occurs when a clot forms directly within a cerebral artery at the site of plaque buildup. B, a thrombotic stroke involves bleeding into the brain tissue due to arterial rupture, while an embolic stroke involves bleeding into the subarachnoid space surrounding the brain. C, a thrombotic stroke occurs when a clot forms directly within a cerebral artery at the site of atherosclerosis, while an embolic stroke occurs when a clot forms elsewhere and travels to occlude a cerebral artery. D, a thrombotic stroke affects only large cerebral arteries and causes severe deficits, while an embolic stroke affects only small penetrating arteries and causes mild, localized deficits. The correct answer is C. A thrombotic stroke occurs when a clot forms directly within a cerebral artery at the site of atherosclerosis, while an embolic stroke occurs when a clot forms elsewhere and travels to occlude a cerebral artery. Rationale: a thrombotic stroke results from a clot forming in situ within a diseased cerebral artery, typically at the site of atherosclerotic plaque. An embolic stroke results from a clot or debris that forms elsewhere, such as the heart in atrial fibrillation, and travels through the bloodstream to occlude a cerebral artery. Both are subtypes of ischemic stroke, but differ in mechanism and source. Question 9. A nurse is caring for a 67-year-old male admitted with a stroke. The physician documents the diagnosis as cryptogenic stroke. The patient's son asks the nurse what this means. Which response by the nurse is most appropriate? A, cryptogenic stroke means your father had a hemorrhagic stroke where the bleeding occurred in a hidden area of the brain that is difficult to see on imaging. B, cryptogenic stroke means your father had a very small stroke affecting only tiny blood vessels deep within the brain caused by high blood pressure. C, cryptogenic stroke means your father had a TIA that was so brief it did not cause permanent damage, but still requires close monitoring and follow-up. D, cryptogenic stroke means your father had an ischemic stroke where the cause could not be identified despite a thorough diagnostic workup.
The correct answer is D. Cryptogenic stroke means your father had an ischemic stroke where the cause could not be identified despite a thorough diagnostic workup. Rationale. Cryptogenic stroke refers to an ischemic stroke for which no definitive cause can be identified despite a comprehensive workup, including cardiac monitoring, vascular imaging, and laboratory studies. It accounts for approximately 25 to 30% of ischemic strokes. Ongoing monitoring, such as prolonged cardiac telemetry, is often recommended to detect occult atrial fibrillation as a potential underlying cause. Now, here's something most nursing students never stop to think about. If a stroke patient is on the right medication to prevent another stroke, can they still stop taking it on their own and feel completely justified doing so? The answer is yes, and it happens all the time. And when it does, the consequences can be devastating. That scenario is coming up, and it is one of the most commonly missed questions on the NCLEX. Question 10. A nurse is caring for a 57-year-old man admitted following an ischemic stroke. During the assessment, the patient reports using cocaine recreationally on the night of his stroke. He has no significant medical history, and his cardiac workup is unremarkable. The nurse understands that cocaine use contributes to stroke through which mechanism? A. Cocaine causes chronic suppression of the immune system, leading to opportunistic infections of cerebral blood vessels and subsequent arterial occlusion. B. Cocaine causes severe bradycardia and hypotension, leading to global cerebral hypoperfusion and watershed infarction in border zone areas of the brain. C. Cocaine causes sudden severe hypertension and cerebral vasospasm, leading to either hemorrhagic stroke from vessel rupture or ischemic stroke from vessel occlusion. D. Cocaine causes chronic inflammation of the cardiac valves, leading to vegetation formation that embolizes to the brain, causing recurrent ischemic stroke. The correct answer is C. Cocaine causes sudden severe hypertension and cerebral vasospasm, leading to either hemorrhagic stroke from vessel rupture or ischemic stroke from vessel occlusion. Rationale. Cocaine is a potent sympathomimetic drug that causes sudden and severe elevations in blood pressure and triggers cerebral vasospasm. These effects can lead to hemorrhagic stroke from arterial rupture under extreme pressure or ischemic stroke from vasospasm-induced occlusion of cerebral arteries. Question 11. A nurse is conducting a health history on a 70-year-old male admitted to the med-surg unit following an ischemic stroke. During the assessment, the patient reports a history of hypertension, type 2 diabetes, hyperlipidemia, and a 40-pack-year smoking history. His brother also had a stroke at age 65. The nurse correctly identifies which of the following as a non-modifiable risk factor for stroke in this patient. A. Hyperlipidemia, because elevated cholesterol levels can be reduced through dietary changes and statin medication therapy. B. Cigarette smoking, because nicotine and carbon monoxide damage blood vessel walls and promote atherosclerosis and clot formation. C. Type 2 diabetes, because blood glucose levels can be controlled through medication, lifestyle modification, and dietary management. D. Family history of stroke, because genetic predisposition to cerebrovascular disease cannot be changed or eliminated through any intervention. The correct answer is D. Family history of stroke, because genetic predisposition to cerebrovascular disease cannot be changed or eliminated through any intervention. Rationale. Non-modifiable risk factors are those that cannot be changed regardless of lifestyle or medical intervention. Family history of stroke reflects a genetic predisposition to cerebrovascular disease and cannot be altered. Hypertension, diabetes, hyperlipidemia, and smoking are all modifiable risk factors that can be controlled or eliminated through treatment and lifestyle changes. Question 12. A 69-year-old male is brought to the emergency department with sudden onset of left-sided weakness and slurred speech that began 45 minutes ago. The physician orders an emergent CT scan of the head without contrast. The patient's wife asks the nurse,
Why is the doctor ordering a CT scan first instead of an MRI? Is an MRI better for the brain? Which response by the nurse is most accurate? A. CT scan is ordered first because it is less expensive than MRI, and hospital policy requires cost-effective testing to be performed before more advanced imaging studies are requested. B. CT scan is ordered first because it is faster, more widely available, and most importantly, can rapidly rule out hemorrhagic stroke, which must be excluded before any clot-dissolving treatment can be safely given. C. CT scan is ordered first because MRI cannot detect any abnormalities in the brain during the first 24 hours after stroke, making it completely unhelpful in the early acute phase of stroke evaluation. D. CT scan is ordered first because it provides superior detailed images of brain tissue compared to MRI, making it the gold standard for diagnosing both ischemic and hemorrhagic stroke in all clinical settings. The correct answer is B. CT scan is ordered first because it is faster, more widely available, and most importantly, can rapidly rule out hemorrhagic stroke, which must be excluded before any clot-dissolving treatment can be safely given.
Rationale. Non-contrast CT of the head is the first-line imaging study in acute stroke because it is fast, widely available, and excellent at detecting hemorrhage, which must be ruled out before thrombolytic therapy can be safely administered. While MRI with diffusion-weighted imaging is more sensitive for early ischemic changes, CT remains the preferred initial study in the acute setting due to its speed and accessibility. Identifying hemorrhage immediately is the most critical initial step in acute stroke management.
Question 13. A 64-year-old woman with atrial fibrillation is admitted following an ischemic stroke and is switched from warfarin to rivaroxaban upon discharge. During medication education, the nurse evaluates the patient's understanding. Which statement by the patient indicates she needs further teaching? A. I need to let my dentist and all other doctors know I am taking rivaroxaban before any procedures because it affects my blood's ability to clot and may need to be temporarily stopped beforehand. B. I should avoid taking ibuprofen and other anti-inflammatory medications while on rivaroxaban because combining them significantly increases my risk of serious and potentially life-threatening bleeding complications. C. I can stop taking rivaroxaban on my own whenever I feel my heart rhythm has returned to normal, since the medication is only needed when my atrial fibrillation is actively causing symptoms I can feel. D. I should take my rivaroxaban with my largest meal of the day because food helps my body absorb the medication properly and ensures it works effectively to prevent blood clots from forming in my heart. The correct answer is C. I can stop taking rivaroxaban on my own whenever I feel my heart rhythm has returned to normal, since the medication is only needed when my atrial fibrillation is actively causing symptoms I can feel. Rationale. Atrial fibrillation frequently causes stroke during completely asymptomatic episodes that the patient cannot feel or detect without monitoring. Stopping rivaroxaban based on perceived symptom resolution is extremely dangerous because it leaves the patient entirely unprotected against clot formation and stroke during silent atrial fibrillation episodes. Rivaroxaban must be taken consistently every day as prescribed, regardless of how the patient feels. And that logic connects directly to something the NCLEX will push you on in a completely different way. When a stroke patient has multiple serious problems happening at the same time, how does the nurse decide which one to address first? Not which one looks the most dramatic, which one is actually the most life-threatening. That priority question is next, and it is the kind of thinking that separates a passing score from a failing one. Question 14. A nurse is prioritizing nursing diagnoses for a 73-year-old man admitted following a brainstem stroke with severe dysphagia, complete right hemiplasia, expressive aphasia,
urinary incontinence, and moderate cognitive impairment. The patient is currently on supplemental oxygen with oxygen saturation of 92% on 2 liters nasal cannula. Using Maslow's hierarchy of needs, the nurse correctly prioritizes which nursing diagnosis as most urgent. A. Impaired verbal communication related to expressive aphasia, as evidenced by the patient's complete inability to express his needs, preferences, and concerns to nursing staff and family members since admission. B. Impaired swallowing related to brainstem stroke, as evidenced by failed swallow screen, nil by mouth status, and the need for alternative nutrition and hydration through enteral feeding to meet the patient's metabolic needs. C. Ineffective airway clearance related to impaired swallowing, brainstem stroke, and accumulation of oropharyngeal secretions, as evidenced by oxygen saturation of 92% and the patient's inability to manage his own secretions. D. Urinary incontinence related to cognitive impairment and right hemiplegia, as evidenced by the patient's inability to recognize the urge to void, communicate toileting needs, or independently access toilet facilities since admission. The correct answer is C. Ineffective airway clearance related to impaired swallowing, brainstem stroke, and accumulation of oropharyngeal secretions, as evidenced by oxygen saturation of 92% and the patient's inability to manage his own secretions. Rationale. Using Maslow's hierarchy of needs, physiological survival needs are always prioritized first. An oxygen saturation of 92% indicates impaired oxygenation, which is an immediate threat to survival. Ineffective airway clearance is therefore the highest priority nursing diagnosis because airway and breathing are the most fundamental physiological needs. Question 15. A nurse is caring for a 72-year-old woman admitted following a hemorrhagic stroke affecting the right frontal lobe. She has no prior history of seizures. The physician prescribes levetiracetam 500 mg intravenous twice daily for seizure prophylaxis. The patient's daughter asks why her mother is receiving seizure medication when she has not had a seizure. Which response by the nurse is most accurate? A. Levetiracetam is prescribed because hemorrhagic stroke involving the cortex significantly increases seizure risk, since blood in contact with cortical tissue is highly irritating to neurons and can trigger abnormal electrical activity. B. Levetiracetam is prescribed because all stroke patients, regardless of stroke type, location, or severity, are required by national guidelines to receive prophylactic anti-epileptic therapy for a minimum of 6 months after admission. C. Levetiracetam is prescribed because the patient's age places her in the highest risk category for post-stroke seizures, and anti-epileptic prophylaxis is mandatory for all stroke patients over the age of 70, regardless of stroke type. D. Levetiracetam is prescribed because it prevents cerebral edema from developing after hemorrhagic stroke by stabilizing neuronal membranes and reducing the inflammatory response triggered by blood in the brain tissue. The correct answer is A. Levetiracetam is prescribed because hemorrhagic stroke involving the cortex significantly increases seizure risk, since blood in contact with cortical tissue is highly irritating to neurons and can trigger abnormal electrical activity. Rationale. Hemorrhagic stroke, particularly involving the cortex, carries a significantly higher risk of seizures than ischemic stroke. Blood that accumulates in or around cortical tissue acts as a powerful epileptogenic irritant by disrupting normal neuronal membrane function and triggering abnormal electrical discharges. Seizure prophylaxis with anti-epileptic medications, such as levetiracetam, is commonly prescribed in the acute phase of hemorrhagic stroke, particularly when the cortex is involved. Levetiracetam is preferred because it has fewer drug interactions and a favorable side effect profile compared to older anti-epileptics such as phenytoin. So now you have your answer. Before you go, I want you to tell me which question you found the most difficult. And if this video helped you think differently about stroke, please like it right now. Not just for me, but because every like puts this video in front of more nursing students and NCLEX candidates who need it just as much as you did today. Let us help each other pass. Subscribe because the next video starts with another question that most nursing students get wrong. I will see you in the next video.